vertebrae and curves in them. Okay, so we'll go ahead and take a look here. This is a cervical vertebrae. And some things that you'll notice about cervical vertebrae are that some of them are forked. They may be forked, and all will have holes in the transverse processes. And if there's more than one hole, we call it foramina rather than foramen. So here's a transverse foramen, here's a transverse foramen, and we call them the transverse foramina. So this is something unique to cervical vertebrae. And what is the significance of these transverse foramina is that the vertebral arteries pass through here. I always love to envision a little baby developing in its mother's womb, and it is forming these vertebrae, and the vertebrae are, start as cartilage, and little tunnels are left in those 7 cervical vertebrae, and then arteries are formed through those, vertebral arteries that will carry blood to the brain. You have 2 artery sources that really provide blood for the brain, and those are the vertebral arteries that actually pass through the vertebrae themselves, and then the carotid arteries, which are more lateral and go up the sides of your neck. Okay, so there's 7 cervical vertebrae. Then there are the thoracic vertebrae. And I'm going to use blue. Now the thoracic vertebrae, some things that you might notice is that the spinous process points down quite a bit. That's something that can be a little obvious. So see how the spinous process is pointed down. Another thing is that they all have transverse costal facets. And so what that means is like right on the edge, there's a little bit of a divot that the the tubercle of a rib fits in. There are 12 thoracic vertebrae which attach to 12 pairs of ribs. The head of the rib attaches right about here, so there's a little bit of a costal facet here on each of those. So each of the 12 thoracic vertebrae attached to a rib, the head of the rib will fit here, the tubercle of the rib will fit here, and then the rib comes around. So this is toward the back of the body, and then this would be toward the belly, and the rib cage would protect the heart and lungs. So those are the thoracic, 12 thoracic. Probably heard me or somebody else say this by now, but you can think of these as the times of days that you eat. You might eat breakfast at 7 in the morning, 7 cervical vertebrae. Eat lunch at 12 noon, so you have 12 thoracic vertebrae. And if you have little kids like I do, you might eat a very early dinner and have 5 lumbar. And the lumbar, what you usually notice is that the spinous process points straight back. But really it's process of elimination. If it's not, If it has holes in the transverse foramina, it's thoracic. If it has costal facets, then it is, what did I just say? If it has transverse foramina, it's cervical. If it has costal facets, it's thoracic. If it doesn't have either of those, then it's lumbar. These are the biggest and heaviest of the 5. So if you add this up, 12 plus 7 is 19, plus 5 more is 24, but you actually have 26 vertebrae, and that's because there is also then a sacrum, I'll put that in green, and a coccyx. I spelled that wrong. So 1 sacrum and 1 coccyx. The sacrum is quite long. You can imagine that this is it right here. There's the sacrum, and then the coccyx is the tailbone. Okay, now we'll look at the curves in the vertebrae. The cervical curvature, use that yellow highlighter. You'll notice that it is convex and tilts this way. And then the thoracic curvature, put that in blue, is concave. And the lumbar curvature is once again convex. These curves are specially designed to distribute force and tension that is going down on the body in the most efficient way possible. If the curves are not the way they should be, then that can radiate out and cause all kinds of imbalances and pain in different joints. But when a baby is born, they don't have these curvatures. It's pretty awesome. Remember that the projections on bones and the position of bones has so much to do with the muscles that are pulling on those bones. So you have to think about, in a baby's development, it reaches different milestones until eventually it's walking. And each of those milestones reflects an increase in the strength it has in muscles. So this cervical curvature is the very first to develop. What's that first milestone that a baby has? Well, it's when it can hold its head up. And, it depends on the baby. But most babies can do this by 3 months. And this is when they're able to hold their head up and the muscles are pulling back to provide that cervical curvature. Okay, then what's the next milestone that a baby has? Well, when it's about 6 months old, it will learn to sit up. And the muscles of the torso develop in such a way that they are pulling on, like right here, the abdominal muscles are pulling, and some of the chest muscles are pulling on those vertebrae and form the thoracic curvature. And then the last major curve to develop fits with another milestone that babies achieve right around 12 months of age. And of course, that is walking. So now once they stand up, that lumbar curvature develops as the muscles of the gluteus maximus are pulling a little bit backward on these vertebrae. So these are the 3 main curvatures. Now, this curvature can be associated with back pain. If someone has what's called lordosis, the way that I kind of remember this is lumbar starts with an L, and lordosis is too much of this lumbar curvature. It's an overpronounced curve here. You might say your back is too arched. And we see this naturally, excuse me, move this, okay. You see this naturally in pregnancy, or maybe in a man that's overweight and has the classic beer belly, the belly fat. Sometimes tall people might develop this, or short people too, just from having poor posture. So if the abdominal muscles are weak, then the arch can become too great. Okay, then let's look up at a thoracic abnormal curvature that is called kyphosis. And that's what could be called hunchback. This is a natural part of aging. The vertebrae weaken and start to collapse downward a little bit this direction, and so this arch this curve can become greater and greater. Right along with aging then means a thinning of the bones, or osteoporosis. Again, poor posture, and this might particularly be the case in someone that's quite tall and they hunch over to not appear as tall as they really are. Also, maybe you've heard of degenerative disc disease, and in this case, the intervertebral discs between the vertebrae are collapsing down, and then the vertebrae are over curving. And then one final curve we'll look at is one that you would see looking at the back of someone. So if this is their back, and here's their spine. If the spine has a little bit of a sideways curve in it, an S, that's called scoliosis. Now this tends to be common in teenage girls, and a lot of times they grow out of it. Occasionally they don't grow out of it, and they might prescribe physical therapy to try and strengthen the muscles on this side of the curve to pull it back into alignment.